We are certainly very concerned about the Delta variant and where it might go. It has shown itself to be a lot more transmissible than the other, even the other variants that we've experienced to date. But I think the good news is one, like I mentioned today from the UK data, is that the vaccine, when people have received 2 doses, is still very effective. The other thing is, as our numbers decrease the overall, a more transmissible variant will normally or naturally become predominant just by default, because it spreads more easily within households or in the certain types of setting among non-immunized people. Really, at this point, we're staying focused on not only the number of people who are getting their first and second dose, but our declining numbers. We're watching and certainly trying to do all we can still with the public health measures in place to contain it in the Calgary area. We are still confident that our strategy is aimed in the right way to get as many Albertans immunized as possible, as soon as possible. As our numbers decrease, it's likely that it will become dominant. But if the numbers are really low, then it's not as big of an issue. Even though it is if it becomes dominant, if we're only seeing 10, 25 cases a day, that's quite different than when we're seeing 25,000, 2,500 cases a day. So it's really we have to take that into context as well. I heard one of my provincial colleagues was mentioning that they're seeing mostly the Delta variant, but if you only have, if you're a small province and you only have a few cases, then it's not as big of a deal than if you have you're in the middle of a big wave. The good news that I have to bring today is that we continue to see the decline in our numbers of COVID cases on a daily basis all across Alberta. Over the last 24 hours, we've identified 127 new cases of COVID-19 and completed more than 4,400 tests. Our positivity rate has declined to about 2.9%, and we've identified 85 additional cases of variants of concern in these last 24 hours. Right now, we're just over 2,800 active cases province-wide, which is the lowest that it's been since October 15 of last year. There's currently active outbreaks or alerts in 216 schools, which represent 9% of all the schools in the province. Hospitalizations continue to decline as well. There are now 271 people being treated for COVID-19 in the hospital, including 68 in the ICU.